I was a professional audio engineer. I toured with some of the biggest bands in the world when I was in my 20s. Later in life, I started freelancing and worked at Cowboy Stadium. I've done all this halftime shows for Thanksgiving, which is very labor intensive. Me and my other buddy who did this for 24 years, we officially decided to retire because we're not going to do any wear and tear on our body. And then for that crazy sciatic type of pain just shooting down the leg, and I almost couldn't walk. And I went to an emergency room. So I actually left. And I already had a pain doctor before for knee problems that I had. And that's when he then pulled up what they were looking at, and it showed that my spine was really pinched. It was almost pinched in half. No spinal fluid was flowing between L3 and L4.
The typical solution surgically is to remove a lot of that arthritis, decompress the nerves. What happens as a consequence is those bones become unstable. But what the system is an alternative to fusion. It will preserve the motion. The two bones in the back that we operate on, instead of being fixed together permanently, which can cause loss of range and motion, it allows you to restore the motion, preserve the anatomy, so to speak, a little bit better, so that not only is the recovery quicker, but also you're able to bend, twist, lift, like you've never had back surgery before, once you're all healed up.
So to be able to spin out of bed and stand up with my feet on the ground and not feel pain in the legs or the feet or the knees, that was cool. So that was immediate relief. The new technology, though, is the exciting part.
We're willing to be the first because we're willing to embrace new technologies, new philosophies, new ways of taking care of people to get them better.
If your spine is almost pinched in half, you don't have a choice.
Medical City Fort Worth is the place to go for that.